All right, good. So, hi everybody. This is not going to be edited, and we talked earlier, so
Unedited.
You guys are getting a raw deal. This is Doc Deb. I call her Doc Deb. How would you want me to call you Doc Deb?
I don't care what you call me.
Yeah.
Deb, Dr. Deb,
Yeah.
works.
So this is kind of a podcast. Instead of the camera going back and forth, we're going to do it together. And, you know, I have known Doc Deb now almost a year, and I wanted her to come back. There's so many things. This is kind of like my hobby. You guys can see back here, we've got our tiny homes. And this is a Sunday. Deb's come up here to just to do this podcast. If I wasn't building homes, this is what I love. I love all the stuff that you're doing and the knowledge. Of course, when I hear you talk, I can't absorb all that stuff,
Mm-hmm.
But to know that I can do things, and you know what it is? You give me hope. You give me hope of the things that's ailing me. And I know we're going to get into this, and
Yeah.
we're going to get into what you guys want to hear, and we're going to do regenerative medicine.
Yeah, our topic today is regenerative medicine.
Regenerative medicine, and I have been delving into that. I've had some stem cell done, and I'm getting some PRP done too. And you've talked to me today about how that works,
Mm-hmm.
which I thought that science was done and over, and it was a fact. And you're like, no, it's evolving, Randy. And there's so
Yes,
many
it
new
is.
things that are coming out. And so that's encouraging for me.
Mm-hmm.
But when I was young, of course, we're all young, and I love to work. I like to physically just work, man.
Me too.
I couldn't work hard enough. I just loved it.
Mm-hmm.
I always told everybody I used to love carrying sheetrock up a staircase. I just loved how it felt,
Mm-hmm.
And I remember going to an orthopedic surgeon or a doctor, and I said, "Hey, is this repetitive work okay for me?
Mm-hmm.
Is it going to break me down?" He said, "No, just keep moving, keep going, keep moving, keep going." All right. Well, my back's crooked, my knees are shot, my shoulders are done, and I'm like, "What happened? What happened to me?" Because I've never been into drugs and drinking. I've always tried to take care of myself somewhat as much as I knew. But my God, I broke down, and it makes me so mad because I cognitively understood that I didn't want to hurt myself working like that, And I even kept my boys out of playing like football.
Yeah.
So their backs and knees would not be bad as mine when they got older, And so I'm finding out now that maybe one of my legs, my femur, is longer than the other, which may have contributed to a shorter leg, which may have contributed to my knees wearing out, which, and then back then in my 30s and 40s, I didn't know as much about diet, even though I was never a fast food guy or anything, but some of the foods I was eating may have deteriorated some of my meniscus. I don't know. But you being here now, to me, it's like a treasure hunt,
Yeah.
But you're bringing so much life to this. And I have experienced now some of the benefits of your protocols that you brought to me.
And not just mine. Like you've
Yeah.
talked to me that before you ever met me, you went and got stem cell injections.
Yeah.
And how many years ago was that?
2 years ago. So I went almost 3, and then I went again and got a second round of it.
About a year ago? Or?
Yep. About 14 months ago I went.
And
Yep.
you had the stem cell injections, what, in your knees?
So I had them in both knees, both shoulders, and in my spine.
Okay.
I could not. It got before the first time I went. I was in the office across here over in the other building.
Yep.
And if somebody said, "Come to the warehouse,"
Yeah.
I had to think about getting up out of the chair.
Yeah. How am I going to do it? Like, it hurts.
And that's from the same guy that built that building.
Yeah.
Physically built that building to where I had to think about getting out of the chair. And it started working on my mind, emotions.
So it worked, because now you don't have to think about getting out of the chair nearly as much.
Oh, yeah.
So
it saved it totally. Because I was mentally going, kind of depressing thing,
if you can't walk. I mean, that's tough.
Look, I'm up, good.
You can feel it, but you're
amazing.
able to get up and down.
I still got pain. I still got stuff I deal with. And to me, like we were talking earlier, I hate to say it, but pain is just part of every day. I just deal with it.
Yeah.
And I hate to get used to that, because you think, you know what, it shouldn't be. And so
Well, maybe we can do something to alleviate the pain. So
yeah,
that's what regenerative medicine is all about. And stem cell injections are a type of regenerative medicine. So,
right.
And why did you go out of the country to get your stem cell injections?
Well, I researched it a bunch. Of course, you were all on YouTube and stuff, and I've seen a couple of podcasts about how I remember Mel Gibson's father was in his 90s, and he said his dad was ailing in so many physical ways, and they took him down to, I think, Tijuana, or it was Panama, and he come back, and within a year, I mean, his liver healed, his kidneys healed. He went even
from stem cell injections.
Yeah, he got out of a wheelchair and was even dating a woman now, and he was like in his 90s. They said it like a rejuvenated. And then Joe Rogan said he had a torn
rotator cuff?
Yeah, gone, fixed it, done. And I heard so many of these fighters from the UFC, a lot of athletes going. And so
they all went down south.
Out of the country. Yeah. And I said, why? Well, because they take an umbilical cord from a donor, not an aborted fetus or anything like that. It's all good to go. Yeah. But out of the country, they're able to culture it, which is grow more stem cells identical. So you can get them here in the country, but you're limited to the volume that you can get. Yeah. You go out of the country, they make millions upon millions. So like when I've got mine, I think I got like 40 million in each knee, each shoulder, 80 million in my back. Then I got a different type of stem cell that was for an IV. So there's a couple different types of stem cells, which I don't know as much, I want to learn more. And then, so today's podcast is in a way of a little bit what I've had done, but to explain, and I want to learn more about. She was telling me earlier about the environment that we have to prepare for that to be effective, the best. And
the physical environment.
The physical environment. Yeah.
So the local environment of your knee, if that's where you're going to get your injection, needs to be prepared. Yes.
And you don't have to spend the time and the big money to go out of the country to get a lot of this done, and so that's a big thing. And so that's what I'm excited about today. And I know as, I've got a buddy who just had 2 knee replacements.
Yeah.
I met a guy at Walmart the other day. He used to work
they're
here.
Trouble.
Yeah, I mean, one guy he says, they're already shot. He already had them, and they're already gone again because they only last 10 years.
So we'll focus on knees because it's an easy way to focus our discussion.
Yeah. Okay. So
like regenerative medicine, we were talking about stem cells right now, but there's a lot more than even just stem cells. There's so many different kinds of regenerative medicine injections. So like injection therapies, we've got prolotherapy injections. Prolozone injections. You can do ozone injections. You can do PRP, which is platelet-rich plasma injections. You can do stem cells. You can do, and then there's Botox and corticosteroid shots. And that's usually what, if you go to a conventional medicine doctor and say your knees hurt or your shoulder hurts, they'll give you a corticosteroid shot. So there's so many different injections. So which ones would you want? I mean, the question here that I proposed us talking about today was, most people don't really understand which ones you would want to use versus another one versus what's going on. So like, what do I want? You might say, should I get PRP injections in my knee, the platelet-rich plasma, or should I get stem cells down in Mexico? And how many different kinds of stem cells are there? So that's what we're going to focus on. So what happens is, so I'll just talk about stem cells since that's where we started.
Okay.
We started with stem cells.
Sure.
But there's a lot of different kinds of stem cells. From my initial research, I'm not an expert on stem cells, but I've done some homework into it. 17 or so or more different kinds of stem cells.
Oh, really?
And there's a lot of the stem cells you'll find if you look into it, especially in the US, they are deriving them from your own bone marrow or your adipose tissue. And then they're mesenchymal cells, and they will they differentiate them and filter them and do these things to concentrate what they want, and then they inject them into the joints that you want, right? Well, it turns out what we're learning is that the stem cells themselves, if it's not a pluripotent cell, so it's derived from bone marrow or derived from your adipose tissue, it will excrete or secrete exosomes, and it's that's actually the powerful part. Like the powerful part of what does the healing in those kinds of injections is just the inflammatory response combined with the exosomes, which are little packets of signaling molecules that help create a different local environment in that area right? So
Okay.
like, just like if you're growing grapes, like let's say you're growing grapes and you have a vineyard, okay? And you're growing Merlot. Let's say you're growing the varietal of grape called Merlot.
Okay.
And you're growing it in Argentina. And let's say another person takes the same that same root stock of Merlot,
Okay.
and they grow it in California. And another person grows it somewhere else in France, right? And they're all from the same root stock. It's a Merlot grape varietal, but you're growing it in different places.
Okay.
That is, in France, they call this this thing in viticulture, they call it the terroir, right? So there's the varietal, the grape rootstock, combined with the terroir, that's the microclimate of where you're growing it, combined together to create the taste of the wine. That's what it is, okay?
Right.
So you need both. The terroir is just as important as the grape. Okay, the actual root of the grape itself. You need both. Our body is exactly the same, okay? So you might have a, pluripotent stem cell derived from an umbilical cord, which is the best. That's what
Right.
you really want. If you're going to get a stem cell injection, you really need it to be derived from an umbilical cord. You don't want it derived from adipose tissue, which is fat, or from bone marrow, because they're finding that it's not pluripotent, and they're not the cells they're not robust enough to survive through the injection, so they can die. And they found that most of them ends up being caught in your lungs, so your lungs will filter it out. So you're sort of wasting your money a little bit. There's a lot of different research on this right now, but you still get a benefit from if you get a stem cell injection that's from adipose tissue or from bone marrow derived. The inflammatory response that happens from the injection is healing. So you could derive a really good benefit from it. So I'm not saying it's not beneficial, but the reason people get stem cell injections typically, correct me if I'm wrong, because you've had them done, is because you want to regenerate cartilage.
You got it.
You want to build cartilage
Yes.
that's missing.
Right.
And in a knee,
That's my problem.
we're talking about the meniscus, this little blue thing right here. Like this is
Yeah.
a knee right here, and there's a little blue piece in here, and that represents the meniscus, right? And that's cartilage, and basically you want to try to rebuild it. Well, and so that's typically why people get stem cell injections, is they want to take this pluripotent cell, that's a undifferentiated cell that has the potential to turn into anything, and what you are hoping it's going to turn into is meniscal tissue, cartilage in your knee,
Right.
to rebuild it. That's the hope.
Yeah.
Okay, so if you do a stem cell injection that's derived from your own bone marrow or your own adipose tissue, this cell typically is not robust enough to survive, number one. And number two, it goes into the local area, wherever you're putting the injection. We're talking about knees, so the knee, and it will typically die. They're finding it doesn't differentiate into what you want it or intend it to, and instead it secretes, the stem cell will secrete exosomes, which changes the local environment in a positive way and stimulates healing. Yay, that's what we want.
Right.
But does it actually turn into more cartilage? No. Okay, so if that's the
So
case,
does that mean it's temporary?
no, it just means that the stem cell injection, if it's derived from adipose or bone marrow, you could get the same benefits from doing something else. For example, perhaps PRP therapy, which is platelet-rich plasma therapy. It does something similar but different, where you take and we'll talk about PRP in a second, but it causes an inflammatory response, it changes the local environment, and promotes healing. So why pay for stem cells when you could do PRP for perhaps less of a financial burden, and create a similar, effect in the knee? So if regeneration is what you're trying to do, like rebuilding cartilage, right? And if the stem cells you want are from umbilical cords, okay, and you want them because they're more robust, they survive the injection process, they survive the transferring and all the handling that has to be done with them, and then they work. They can actually turn into new cartilage, right? Now, but they don't always. That's, if you look at the research, the results are all over the board on stem cells, like the efficacy rate of whether or not it works. Does it work for everyone? Does it work for 10% of the people, or 20% or 30? Like do 50% of the people have cartilage that's regrown? That's efficacy, right? How well does it work? And the answer is different studies showed totally different results. And we're trying to understand why. Why would stem cell injections derived from an umbilical cord work in one study and not in another study, or for one person and not another person? And how do you increase that? How do you increase your chances that it'll work?
So we go back to the grapes.
That's right. You prepare the terroir, right? You have to, if you had all these amazing, seeds and you wanted to plant a garden, you're not going to have all these weeds in the garden, in the soil, and just throw them out and expect it to grow. Like, that would be ridiculous. Everybody knows you have to get you have to rent a garden tiller from Lowe's or buy one.
Prepare the soil.
You have to pull the weeds. Sometimes you have to torch the weeds and then till the soil, right?
Yeah.
And make sure all the seeds that are the weed seeds are
Put
gone.
nitrogen in it, or
and then
whatever.
you amend the soil. You put the amendments in it, and then you dig and then you plant the seeds. And then after you plant them, you then feed them again. You feed them with your Miracle Grow or your.
So our toiling, preparing the environment is.
So yeah.
The whole protocol
That's right. So if you're going to get, if you want to increase your probability.
There you go. Yeah.
Of a successful stem cell injection in your knee
or PRP or whatever.
You have to prepare the environment, okay? You have to prepare the environment. And there's a lot of different ways to do that. What they're finding, you can get exosome injections, right? And exosome injections are what the stem cells secrete to create a local environment that's amenable, that it's a signaling molecule. So then if you get stem cell injection later, the environment will signal the cell turn into cartilage. Like, it's telling the stem cell, because remember, the stem cell is pluripotent. That means it can turn into anything. So why would it turn into a zucchini plant when you want, an asparagus or something?
Right.
You have to tell it. What tells the seed that can be anything?
Then how do you tell it? Is preparing
You prepare the local environment. And,
Wow.
and exosomes are a great way to do that. So exosome injections in advance of the stem cell injections, right, will help create an environment so that way the stem cells have a higher likelihood of then turning into what you want it to turn into. That's one way to prepare the environment.
Okay.
Another way to prepare, there's other ways, because there's many injection
or a
therapies.
combination of all of them, right?
Absolutely. I don't like to ever, my style is not to do any one thing. I like to do multi-pronged approaches. I think I use that word with you a lot. Let's do a multi-pronged approach. So that's my style. There's no huge studies that show multi-pronged approaches, because it's hard to, they like to take one thing and study it. And so, there's not a lot of studies to prove these multi-pronged approaches, but they have shown that you have a higher success rate if you prepare the environment first with like exosomes.
Yeah.
So what happens is a lot of people, doctors, physicians who are doing stem cell injections that were derived from adipose and bone marrow don't do that anymore. Instead, they just do exosome injections, right? And then after a certain number of exosome injections, then they do the stem cell derived from the umbilical cord, right? And you have a higher success rate. Okay, so. And it's the same. Like, if you took this expensive pluripotent stem cell and you didn't prepare the environment, it's like throwing a seed, into the area and then just hoping, God willing, it turns into what you want. And some people, it succeeds, it works, right? And some people, it doesn't, which is why you have these variable success rates on all the studies. Like, sometimes it works, sometimes it doesn't. We don't understand why.
Yeah.
That's what they're starting to suspect. It's because of this local environment. So what else can you do? So, like, if somebody came to me with osteoarthritis in their knee, and they had shown a history of repetitive use injury, meaning they used their knees a lot. Let's say they were climbing up and down a lot of stairs with sheetrock, or let's say they were a competitive cyclist, right? That's a lot of bending of the knee, right? Mm-hmm. A repetitive use can lead to not always, but many times can lead to osteoarthritis of that joint, right? Joints that are used a lot over your whole lifetime are are the ones that are most vulnerable to having
Right.
osteoarthritis,
Okay.
okay? And because inflammation happens there, irritation happens, and then bone spurs can start growing because to try to protect the irritation, and then you've got more of a problem because now you have bone spurs hitting each other, and then the doctor will say you have bone on bone, which I hate those words,
Yeah.
but you know, yes, that's all true. You know,
And I don't want you to go with that, but is there a way of being able to do repetitive, like run 40 miles a day, bike and work like I wanted to, and not have degenerative joints?
In my philosophy, yes, there's always things you can do to try to protect the joints that you are using a lot of, right? And you know, there's supplements you can take, of course, like the MSM is a supplement that it has a sulfur component in it, along with glucosamine chondroitin. You can buy supplements that have all of these combined. Those are all helpful.
All that.
You know, vitamin C, plant-based vitamin C, is the precursor to collagen synthesis. So
No sugar, diet,
right, so like you got to lower the inflammation and the irritation everywhere in your body, but the joint as well. So like let's say you run a marathon. After the marathon, you need to give your knee joint, because you've bent it a lot by running and pounding on it, you need to give it a little tender loving care for a while, like to, you know, just like some people go get massages after they do an Ironman triathlon or something. You need to give your body some tender loving care after you do some of this repetitive injury, and that might mean gentle traction of the joint, right? So what do I mean by traction? Well, like hanging upside down, maybe not completely upside down, but like on a tilt table, like, you know, get an inversion table and slightly, even if it's just for 5 minutes, that's going to pull the tibia and the femur apart just gently and create space. And it creates like a vacuum. So like when you have traction on any joint, that includes your vertebrae and your spine or anything, when you pull it apart, when you pull the femur and the tibia apart, it creates a vacuum in between the two, and it sucks and draws into the joint the yummies from the extracellular matrix, the local environment that's around it, right?
So 30 years ago, even though I come home and I felt great, I should have been doing something to my joints.
You know, I would take some MSM, glucosamine chondroitin, some vitamin C to make sure you had all the precursors you needed nutritionally.
Wow.
And then I would have probably done some, you know, massage. Make sure you don't have any scar tissue on the ligaments on the side, right? And you can use different Graston techniques to type of massage, or some vacuum cupping therapy to like get some of the scar tissue out so it's not getting too stiff right in here on the ligaments on the side. And you know, and some you can put a DMSO gel, right? A DMSO gel all over your knee that'll rapidly absorb directly into your bloodstream, but it's analgesic and it's sulfur. It gives your joint sulfur, which will be sucked right up into there to try to repair anything that got injured from the repetitive injury that you were doing that day, running a marathon, whatever you were doing. Right. So yeah, there's preventative things you can do, right, to, you know, help slow the degradation of the cartilage and repair it right after you damage it.
So you got, as you're, you know, if young people did this and if I would have done it 30 years ago and preventative and known to do that, it may have prevented the loss of the cartilage that I have.
It could have at least slowed it down dramatically.
Yeah,
so you
because I mean, everybody wants to keep working. Everybody wants to keep running. We want to keep snowboarding, you know?
Yeah.
And if I'd have known it.
Water skiing.
Yeah, so exactly. So, but now, okay, so now we got a lot of folks, I'm sure, have got the problems.
So now we're here. So
now
it's too
we're
late.
broke down.
You can't go back 30 years.
And now we need to prepare that environment.
Yeah.
And a lot of that is lifestyle, drinking and smoking and doing all these other things.
Yep.
But what we want to show you today, maybe a little bit, and we're gonna, and we want Doc to come back a lot, and we've got some really cool things that I want to do with her in the future, but to get a protocol together, you know. And so this is to inform you that, you know, like I'm doing the vibration thing. I know a lot of people got that last time we had a podcast.
Whole body vibration is very, very important if it's done the right way. It can actually stimulate bone resorption, resorption is like the dissolving of the bone spurs. So any bone spurs that you grew because of inflammation and irritation between the joint that's hurting, you can slowly persuade the body to remodel the bone, okay?
Yeah.
Through the tailored use of a whole body vibration plate and compression of the joint, compression.
Mine's got like stalactites hanging everywhere.
Yeah, that's bone spurs, right?
Yep. And in my shoulder. So what I'm doing is I'm on that thing and I'll squat down just a little bit. Oh man, it hurts. I can feel, it feels like there's just bones hitting like this.
Yeah. So you got to be gentle. You don't want to like overdo
Well, I mean,
it. But you go to where that pain point is, back off a little bit.
Before I pass out, I straighten up.
You gotta be careful with you. I just gotta be careful with you.
Yeah.
So like you don't want to cause more inflammation and irritation.
Right.
You want to just get to the point where you have some compression, and then hold that vibration at around 30 to 40 hertz.
Okay.
Right. That's the best for bone remodeling. And then it will, if you do it 5 minutes a day, now and then, it will slowly persuade the bone to remodel. The osteoclasts will be stimulated to chew up those stalactites you're talking about or whatever, right?
Yep.
Anyway, those little bone spurs. But it's a long process. Bone remodeling takes a while. But, people don't understand, but like, when a tendon, like this is the patellar tendon right here, right? And the patella's right here. And this is how your knee bending like this, right? Okay. And this tendon is a very strong tendon that goes all the way to this tibial tuberosity right here, and it connects, and you can feel that tibial tuberosity on your knee. It's a little bump right here, right? And some people, the bump is really big, and some people it's not as big. Well, what makes the bump? Like, what makes any bump on a bone? Like there's a bump, the bump that the tendon is attached to. Well, the bump forms because the tendon is pulling on the bone. So when you pull on a bone, when you pull on it, it makes bone grow. Bone grows when you pull on it. And when you compress, when you have a compression, over time, it dissolves, okay? So what happens is if you're doing a lot of knee bends in your life, right, you will find that you will have a bigger tibial tuberosity than other people because this tendon has to be strong and it's been pulling on the bone repetitively, right? So, and this goes for anything, like even the deltoid. The deltoid attaches, and you can feel usually the bump on the bone where the deltoid comes down and attaches. That bump is there for the muscle to attach to, right? So bone growth happens from pulling on the bone, usually tendons. That's the only thing that pulls on bone typically is a tendon. And then pushing on it will dissolve it, right? So compression stimulates the osteoclasts or bone resorption. So, but you got to be careful because you don't want to irritate it as well. And irritation, inflammation can cause bone growth, like the stalactites you're talking about, the bone spurs. So you got to be careful and direct about it. But whole body vibration is one of the best things to do with the right frequency to try to repair whatever went wrong in the knee. Right? Like decades of repetitive use injury, the whole body vibration over time can repair it. Okay?
And you gotta be patient, because I know I've been doing this for a couple months now, and I'm like, God, it still hurts. Everything's still, I feel like I'm not getting any better, you know?
Yeah.
But and like you said, you got to give it lots of time. So I'm like, okay, I'm setting my sights on a year now.
But you're doing a lot more than just whole body vibration.
I'm doing a ton
You're
more.
doing platelet-rich plasma injections. Right?
Yep.
And
red light therapy.
Red light therapy as well,
Magnesium
right?
and DMSO.
Yeah. So you're doing
My diet.
Yep. And you're doing even the MSM capsules occasionally when you think of it, right? With the glucosamine chondroit and vitamin C, plant-based vitamin C for collagen synthesis. So you're like doing the superhero protocol. It's great. But all of that changes the local environment. Like you are changing this environment, which is going to stimulate your own body's ability to try to heal the area. Okay?
Yeah.
And you can even do hyaluronic acid injections, which is creates more of a lubricious environment, so lubricating. And so there's just so many different kinds of injections you can do to help gap the joint a little bit, create the space needed, so when the whole body vibration stimulates the knee, all of the yummies know what to do. The cytokines, all the inflammatory markers know, I got to come here and rebuild cartilage or whatever, right? And fix things and dissolve this bone here and build more bone here. And the remodeling happens. The vibration is the signal to use what you've just injected in there properly,
Got
right?
it. Got it.
And
Yep.
then, but so very select specific compression, that would be like doing a squat, on the whole body vibration plate, maybe with a little bit of weight, like holding a 10-pound ball or something. So a little bit of gravity induced compression of the tibia and the femur together under a small, bend, so
Right.
flexion, and holding it for 10 or 15 seconds if you can hold the squat, right? And then coming up, that is the compression to dissolve the bone spurs. Then you also want to do traction, though. Then you get off the whole body vibration plate, and a physical therapist will grab your foot and your ankle and pull it gently to gap the joint. It'll pull the two apart, and that will draw into the area the yummies, right? All the good stuff. So so for example, let's say you just got a PRP injection. We just injected you, okay? Then what happens is you could, in an ideal world, you would get on a whole body vibration plate, do some gentle squats for about 60 seconds, maybe 120 seconds, so 1 to 2 minutes, some gentle air squats, just up and down, bending, right? To get the yummies that we just injected into that whole area, and then do some gentle traction. So then get on a massage table or a bed, and then gently pull the leg, hold it for 5 seconds, and then pull the other leg, right? So you're combining compression and traction, but to do two different things, right? The traction draws into the meniscus all the yummies you just injected in there, right? And then the compression and vibration, the vibration does two things. It signals all the cytokines that you just injected to work here. You're saying, work here. This is where I want you to work. I want you to work right here. The vibration stimulates the activity. And then the compression of having a ball, a heavy weight or something, or even just gravity and doing some gentle squats on the vibration plate and holding the compression, that stimulates bone resorption. So you're doing like multiple things all at once, to try to create a different local environment because remember, our body responds and is enormously adaptive. We adapt to our changing environment. This is why when astronauts go up into space, all of them get, 100% of them get osteoporosis, all of them. Right away, okay? And it's
right away.
Yeah, because their environment no
gravity.
longer has gravity. And so our bone immediately responds to a zero gravity environment. Immediately. Our bones don't need to hold any weight anymore. So they become like bird bones, and they just start, the osteoclasts, which are the chewers, the part of the bone, the cells that chew up bone, just start chewing it up, and your bone becomes very porous.
Because no gravity.
Because of no gravity. Because why? Your body's like, I don't need to have strong bones because why do I need strong bones? There's no acceleration happening. Gravity is an acceleration, okay? There's no acceleration. There's no reason to have strong bones in zero gravity, right?
So our bodies are adapting to
Yes, and it happens
Wow.
immediately. And so it's a huge problem for our astronauts, osteoporosis, and it's not. We can't prevent it with our astronauts. They just know they're going to have osteoporosis. But the thing is, they can delay it. They can slow the osteoporosis, and the way they slow it is by putting like a bar that you would squat with, but it has a band, or a mechanism that holds them down
because
onto the plate. And so they are standing on a plate
while they're up there.
While they're up in the space station or whatever, and they have this, and they do squats on a plate that's vibrating, right? So they're creating a false gravity by holding the bar and doing squats, and they're putting compression on the bones while they're under vibration, and that stimulates bone growth. Okay? And so
if does that go? I know we got gravity on Earth, but if somebody doesn't move much and they just get sedentary, that's why it's so bad. Everything else can just...
Right, you don't need strong bones. No reason.
Wow.
I tell women who have osteoporosis who come see me and they're like, I just had a DEXA scan and the neck of my femur, that's a very common place for osteoporosis to first show up. That's where it shows up first, okay, for women typically in menopause. And I'm like, okay, so they're like, well, what do I need to do? And I'm like, well, do you walk and go on hikes, or what do you do? Well, yeah, I try to walk or whatever. I'm like, okay, great. Well, you can walk with a weight vest on, right? Because increase gravity. If you increase gravity, then your bones will respond.
And they will
get
respond.
Stronger. They'll get stronger. They'll get more dense, right? So you can put ankle weights on.
Is that why I think you had said once before, a female who's really small and you get old, you're more likely to
Absolutely.
than a heavier
That's right.
person.
Yeah, someone who's like 115 pounds or less has a much greater risk of osteoporosis than someone over 120 pounds because their own body weight, a heavier female,
Yeah.
their body weight is even if they're healthy,
Yeah.
their body weight will make their bones strong, right? If they're taller, let's say they're 6 foot woman or something,
Yeah.
they're gonna be heavier naturally. Well, that heaviness will create stronger bones.
I'll be darned.
But a smaller woman is like a bird. She doesn't need strong bones. So the bones, because she's not holding that much
Yeah.
weight against gravity.
So you smaller ladies need to get a weight vest.
That's right. Weight vests are great.
Yeah.
Go on your walk, and even if it's just a 5-pound weight vest, or
Yeah.
if you can wear 10, even better. And an even better thing to do, even beyond a weight vest, although that's a great one, is jumping. So like jump roping. If you can jump rope, that's like the best medicine ever. Is just do 60 seconds, a couple minutes of jump roping a day, because when you jump, you are impacting, you're hitting the ground, and your bones see that as a huge acceleration. Boom, and it reverberates through your whole bone, and then that stimulates the osteoblasts, the
Got it.
builders, to build bone.
And if you don't jump rope, you get a vibrating plate.
That's right. So if you can't jump because you're like, my knees hurt, my hips hurt, my
Yeah.
back hurts, everything hurts, I can't jump anymore, right?
Yeah.
And a lot of older women who have osteoporosis can't jump. They're not going to be jump roping, right? So then stand on a whole body vibration plate and do little gentle knee bends and knee squats, right?
Yeah.
Okay. And I give them these resistance bands that go around their legs, and I tell them to push their foot out. So I have them hold on to something,
Mm-hmm.
right? And then go like this with a resistance band, go like that, because that puts a stress on the neck of the
get you,
femur.
right.
And it does it under vibration, which is going to increase the bone density at the femur, the neck of the femur.
Right.
So you want the area that needs to have increased bone density or you want that area of the bone to be under stress
Yeah.
while you're under vibration, and then that will build bone.
Well,
right?
see, you know what? I have a bone spur on my left shoulder.
Mm-hmm.
I've had it for 10 years. So now I've got on my vibration plate, and I'll do push-ups.
Push-ups. Yes.
And then I'll and I can normally do 50, 60 push-ups.
Yeah.
I can only do about 25 or 30 on there.
Yeah.
It is like taxing,
Yeah,
man.
but the thing is, if you can do it, if you're willing, but I don't like to beat the body into submission. I'm not someone who's like, I do
Yeah.
not beat the body. Gentle, like, let's be as gentle. Okay, you hear me? Okay. so like, do a couple push-ups, maybe 10 or something. Like, just, you don't have to be like, oh my
go
god,
to exhaustion.
Yeah, don't do that.
No.
Okay. So just do what you can, right?
Yeah.
And you'll feel it localized in the
Oh,
area
yeah.
that has the bone spurs, right?
Then I'll hold it and just straight armed it.
That's great. Because what happens is the acceleration from the vibration is going up through your bones, and it will stimulate the area that needs to be healed and remodeled. Okay. But like I've talked to you before with people who have frozen shoulder, like the pain windows, like from here to here. So like usually it doesn't hurt when they put their arm up here, and it doesn't hurt at the bottom, but like basically from about here to here, like it hurts. So like if they like holding something out like
Yeah.
this, like, oh, ow, it hurts really, really bad, right? Well, that is usually it's a bone spur on the end of the acromion, right? This bone right here, and it digs into a muscle called the supraspinatus, right? And so it hurts because the muscle's being cut by a bone spur on your shoulder. Now, why? Why does this bone spur even form? Well, anybody who does things in front of them and like repetitively, like type on a computer, or a hairdresser, right, that's combing hair and using a hairdryer, right? They're using their arms out in front of them like this all day long, right? Okay, that will eventually usually form a little bone spur, and then that bone spur will make it so it digs into the supraspinatus muscle, and it hurts like crazy, and it damages the muscle. I mean, it's like cutting. So how do you get rid of that bone spur? Well, remember, compression stimulates bone resorption, right? So I tell my people with frozen shoulder, if they can still move their arm a little bit, it's just painful. I say, okay, put a pull-up bar, one of those portable ones that you can put in your door frame. Put your hands close together, so not far apart. I want them close together, and then it doesn't have to be perfectly, just, inside of your shoulder width.
Yeah.
Okay, so something like that, and then hang from the bar for 30 seconds. And you're not trying to like lift and do a pull-up. Like, I don't want any tension. I want you to exhale and become as long as you can get. I mean, really extend your arms and just exhale into this lengthening, right?
Yeah.
And you don't have to have your feet off the ground. You can just bend your knees and let your body weight hang from the bar, right?
Right.
And if you haven't done this since a little kid, then that's harder than you think, just even hanging there. But you'll feel it in your shoulder.
Oh yeah, I'm doing that too.
Because what happens is the head of the humerus in this position will push on that bone spur. It'll compress.
Yeah, it's helped me. It has.
It compresses like this. And if you can hold it for 30 seconds, it will stimulate bone resorption, and the hook on the acromion will dissolve. It'll dissolve. So I tell people 3 times a day for 30 seconds, hang. And if you can do that for 2 weeks, your pain will start going away. It's just all of a sudden, the frozen shoulder starts going away, and it doesn't cost anything. All you got to do is hang. The problem is convincing a human being to get into the habit of doing anything consistently is very difficult.
That's the answer to all this.
Yes. You got
all of it.
Yeah.
To give it consistency and time to do it. Like I started doing that, hanging, and
it's hard.
Yeah, I tried.
The consistency,
count. And I count. So I
30
count.
30 seconds.
Well, I push
you
it.
overdo everything.
Well, I'm thinking, is it just going to be better? And I want to get my grip stronger and all that stuff.
It's not always better. But still,
But it has helped. This shoulder, from the first tiny home that I built.
Yeah.
And I had stucco all inside. I put 4 coats on it, had all this.
So you're using your arms in front of you, doing stuff like this all day long.
It was never the same after that.
Yeah.
And it was about a full week of doing nothing but stucco. And I was both hands just going and nailing and going and loved it. Man, for some reason, I was like, whoa. And that was 10 years ago.
Yeah.
And the pain has always been there. It's like,
the bone's not going to resorb, unless you signal it to.
I didn't give it any. I used to have to throw my arm up there to get it up there.
Right.
Just, get it past that pain.
That's right. There's a pain window. And usually if you can go like this, sometimes you can get your arm like that, right?
That's what I've done.
You go like, because it's this motion that the supraspinatus muscle is controlling the arm, and it's horribly painful.
Yeah.
And it's because the muscle's being cut. So there's other eccentric exercises you can do and those kinds of things. But if you understand the physiological triggers of what stimulates bone resorption and bone remodeling, you can tailor what you're doing to try to create a new environment. To reverse it. Now, it's going to take a long time. It took you decades to get where you're at.
And you guys what the thing is, and I want you guys to have, that's what I said at the beginning. She's giving me hope that it can go away. Now, I don't want to get new knees. I've had all my buddies, they chopped off their knees and they got all this titanium now in them.
Yeah.
And I'm just like, no, I want to try to do this. Now, me waiting on that, it hurts. I got pain. I wake up, and my biggest thing.
But the PRP's helped a little, right?
PRP's helping. The vibration's helping. My diet's helping.
Just a little bit. It's like tiny little.
And I'm crawling up that ladder of getting better and better. And the biggest thing that I have found is sleep.
It lowers inflammation.
If I do not
sleep is medicine.
I feel like a truck has hit me.
Oh yeah.
And I was like, my thing is, if I don't sleep, I still truck on through the day. Most
of us have to,
I
right?
still kill it.
We have
right?
to make a living.
And I know there's still, I know I'm not up to par, but I haven't slept really good. Sometimes I only sleep 2-3 hours of the night. I'm like, I can't go to sleep. I know. And then I force myself to go to sleep. I'm trying to, what can I do? And I got red sunglasses now. I'm trying to wear at night.
The blue light blocking
glasses. Blockers and I'm all this stuff. But I'm experimenting with my body. I love experimenting. And I'm like, whoa, I feel like somebody has poisoned my entire body, man.
Yeah, sleep is medicine. It's where a lot of our rejuvenation happens, our detoxification cycle in our liver, our brain, all of the cerebrospinal fluid comes and washes out plaques during our deep sleep. So
gotta have it. And it's so important. I took about a month ago, I took some time off.
Yeah.
And I made it a point to rest.
Yeah.
I made it a point. I said, so I turned off my phone for the first time in 10 years. I turned my phone off.
Looking at it.
and I prepared the business for me to get away. And when I set my phone away and I laid down, do you know, everything subsided, my pain subsided.
Your heartburn went away.
I had no indigestion, nothing. And the
Rest
stress
and
was
digest.
down, the rest was, I couldn't believe the difference in my body.
Yeah.
And when I come back, I thought, you know, I've got to create that environment somewhere in my natural life, you know?
It's really hard sometimes though, because, you know, like we feel like we have to do what we have to do each day, right?
I've got to, you know, I've got
That's
all this
right.
going on, you know, and I've got commitments. And so anyway, I don't want to, you know, totally get off on that. And, you know, the normal people that are out here that's got your aches and pains, my biggest thing is give, if you know, I want to bring Deb on more so she can set these protocols for you. And she's got her own YouTube channel, and she's wanting to maybe get these to where if you have these, you could actually get this whole system and apply it and create this environment. And if you do want to do any kind of regenerative injections, that you can know where to go, what to do, how to prepare for it. I went and got mine 2 years ago. I did the best I could. I didn't know anything like that. I did
But
my
it worked
diet.
still. It still worked.
It still worked.
Yeah.
And now that I'm learning more, I'm excited for the future that if I prepare my body better, my joints better, I can even get more.
More benefit, absolutely.
And, you know, and the one thing I'm going to tell you guys, the one thing that really, it's a lot of this is mental. I swear it is, because you told me, do not talk, like, don't keep telling yourself you're in pain or you got this. It's not going to go away. It's not going to get any better. And the older we get, you don't get any better. And
yeah, your words and your thoughts make a huge difference.
you know, I've listened to you.
Just say, I'm getting younger and younger every day. Just say it.
Yep.
Getting younger and younger.
Well, you know what I do. I mean,
get stronger, younger, less pain, healthier. You got to tell yourself that, and you got to do stuff to back it up. But your words are important, and the words you use in your head are important. Like what you say to yourself, like, "Oh, this is my new normal. This is just new normal." No, don't say that. My parents say that sometimes. I'm like, "No, this is not a new normal. We're gonna fix this. Like this can be fixed. This is not a new normal."
I listened to everything you say, and I thought, well, if I'm doing what you're telling me to do, the physical portions of it, and now you're telling me to speak to myself differently and think differently, I said, I'm going to do that too.
Yeah.
And so my goal is now, I'm going to be 65 this April, and I'm like, you know what?
65 years young.
believe it or not, I'm in better shape now than I was 20 years ago.
Yeah.
I was broke down at 45.
Yeah. And my goal for you is to have awesome knees a year from now. So
I
one year
want to
from
be
now, you'll be
snowboarding
like,
next
I
year.
don't know what happened, but my knees are so much better now.
Yeah, and I'm killing. I want to do everything that I can. You guys won't believe, there's so many cool things that she's got that a lot of these, like we were talking this morning about the movie stars doing with their skin and their cellulite and how we can do that with carbon dioxide. There's so many cool things that I'm excited about. And
Absolutely.
I think, if anything, all that right there just gives me hope, because there's so many more things I still want to do, man.
Absolutely.
You know, you talked about hang gliding, and I want to go to the Alps and jump off one of them mountains and just glide down into the
Paraglide,
depth.
absolutely.
I want to do that, you know?
Yeah, me
and
too.
the only thing that's holding me back now is
I intend to water ski till I'm past 65 years old. And I'll tell you, it takes strong legs and knees to water ski. And I
Yeah.
intend on water skiing past 65.
Yep. And the new bicep is the gluteus maximus. Okay?
Nice tight glutes.
Yeah, and you know, and I've tried to do a lot of squats because I'm trying to prevent my back from getting hurt. Okay, so we had that cold spell, all right, here about a month ago. We've been for a whole month. Horrible here. I come out of my tiny house.
Yeah.
And my feet went completely into the air. Both feet, I could look up and see my feet in the sky.
That's
and when
not
I come down, I hit my back right on them steps, and then I bounce to the concrete.
This is not
First
good.
thing I did is like, who just seen that? I'm looking around, I was like embarrassed.
Well, I
and
didn't
then
get a concussion.
and then I thought, oh no, I am gonna not be able to walk today or tomorrow. And you know, all I had was a slight bruise on my tailbone. And I thought,
Did you
Randy,
get on the whole body vibration plate?
had I been?
Did you do it after you had that incident, that fall?
Oh yeah.
Because that's the thing to do. Like
I did. Oh yeah, I'm on that twice a day for 10 minutes.
That's right. That's because like if you have a fall like that and you're able to get up and you didn't break anything, whatever, you probably have little micro fractures in your vertebrae, and you probably have little micro fractures somewhere, right? Tailbone, sacrum, and so if you get on the whole body vibration plate and even if you just stand on it and just twist back and forth, it will stimulate the immediate repair of those microfractures.
Well, I did. I mean, I do that part of my protocol.
Yeah.
But I was so glad because I'll show you guys a picture of my spine. I'm gonna get my phone out and show y'all. But I think because
looks like an S.
I got some mass around my butt and my back, and I try to work it out strong. Yeah. And I think that may have prevented a lot of what could have happened.
I think there's many things that probably, like your strength of, definitely in that muscle mass as a pad for sure. But I think also your bones were healthy. They could take the impact,
that's true.
And so there was probably a lot of things going on that helped you survive that, well, not survive, but like not be seriously injured in a worse way, right?
Look, I'm going to show you guys a picture of my spine here, okay? Can you guys see that? That is my back.
That's impressive. That is an impressive spine right there.
Look at that thing. And they're saying I may not have had that at birth, that carrying all that wood and logs and building for 30 years may have created that. Now, so I got it to where that back I couldn't even grab a jug of water and put it on a water cooler. It felt like my vertebrae were just going to
When was that?
3 years ago.
3 years ago. So what have you
Before I
done
went down there.
in 3 years that you think might have contributed to at least alleviating the pain of that curvature or whatever?
First and foremost was the stem cell.
Okay.
I could not sit up in bed. When I woke up in the morning, I just can't sit up, right? Anything on my back was hurting. I mean, I've carried logs and logs and logs and logs and lumber forever. And I couldn't do it anymore. I couldn't grab anything out front here. Anything out here, it felt like my back was going to snap in half.
Yeah.
I had 2 rounds of that in my back, those stem cells.
Yeah. Made all the difference in the world.
I grabbed 40 pounds, boom, done. I get up, sit straight up in my bed.
Yeah.
And that was without knowing you before that and creating an environment like you're teaching me now. And the only thing I did yoga a lot.
That'll help a lot too. Stretching and twisting and movement cures. So, but it's frequent, varied, and different movement. So you can't do the same movement you've always done. You have to pick new movements, and moving your body in a different way than you normally move it will help fix things a lot of times on your own.
Yeah. You guys, the thing that I've learned is that if you want anything to work, and we were talking about the young generation now and us and stuff and how they're different, is that it's still cliche, pain is gain. And I hate to say that, but you have to be uncomfortable to benefit. You got to get your body uncomfortable, I've told everybody I'm doing these, I try to get into a cold shower every morning, like Curtis out here.
You're talking about hormesis, which is, that's the concept that our body actually responds to stress and gets stronger. To a certain extent. If it's too much stress, then you break, right? But you gotta give your body some stress. So in your case, the cold shower you're talking about, right?
I hate
that
it.
is a temperature stress that you're inducing, and that will create a hormetic response, hormesis. Okay. And it will create a physiological response that makes you stronger.
Really? And I do it because I don't want to do it. I get up in the morning and I'm all warm.
It's like exercise. People also don't want to go to the gym, right? Because it's a stress. That's a different kind of stress. So there's heat and temperature stresses. There's like hot and cold. There's also, exercise. There's all kinds of different stresses that we can purposefully induce, and it makes you stronger. It's a hormesis.
So in doing everything natural, you have it, like we said earlier, it takes time. Takes time. Consistency, and it's going to be some painful on it. But in the long run, we're going to be better off. 20 years ago, they wanted to give me new knees. Yeah. Both knees were shot 20 years ago.
Yeah.
20 years ago.
Well, you're walking around now. I watched you walk up the stairs up here just today, and I was watching, and I think we got a lot of room for improvement still, but you're able to walk up the stairs carrying all my bags, you know? Like, you walked
Couldn't
up the
have done that
stairs.
a couple years ago.
And so, you weren't limping and stuff like that. So, just a little bit incrementally, we can create a new environment and promote at least the alleviation of pain and get you doing things you want to do. And if that means snowboarding, perhaps we can get you strong enough to snowboard. Maybe you won't be an Olympic snowboarder, but we can get you doing what, it won't inhibit your lifestyle.
Yeah.
And so, there's all kinds of regenerative medicine. It's worth looking into it for sure. Definitely, if you're told you have bone on bone and there's nothing you can do, surgery is your only option, I would be cautiously skeptical of that evaluation, and I would seek out alternatives, because there's a lot you can do. Even if they tell you have bone on bone, there's a lot you can do besides having a knee replacement that can fix things. And a lot of times, it's not even a degenerative knee that's the problem. Like, I've had people tell me their doctor says they have to have a knee replacement, it's bone on bone, and all they had was scar tissue in their IT band, and I used a Graston technique combined with a vacuum cupping technique to comb the scar tissue out of the side of their leg, and it pulled the patella. That's this part right here. It pulled the patella back into position because it was this tendon, this IT band was so tight, it was pulling the patella over and causing this pain. And once I got the scar tissue out, which took about 3 months of concerted work and pain, combing it out with externally, like with a tool that I use, right? And it's a massage technique, and it pulls the patella back. Now the patella can relax into its correct position. The knee pain went away. The knee pain went away. There was no need for knee surgery, none at all, okay?
Wow.
So I would just explore alternative, just to make dang sure you need that surgery, because sometimes you don't. And sometimes you can do PRP. And some people are like, oh no, I tore my ACL, I tore my MCL. Or I have a meniscal tear, they say you can't repair it. Well, there are a lot of studies that show that for meniscal tears, PRP therapy is better than knee surgery. There is more efficacy for meniscal repair with PRP injections than there is with meniscal tear surgery.
Really?
Yes. It's a higher rate of success.
See, when I was 29, I had a torn
ACL or meniscus?
Meniscus, and they removed part of it.
Right. Well, they'll do that. They'll the part that's squished out.
Never had the
they'll
same.
Just carve it.
I lost range of motion.
Yeah. So
where is an ACL and an MCL?
So M is like medial cruciate ligament, and then there's MCL and anterior cruciate ligament. They're the ligaments that are, you can't even see them, but they're like way inside here.
Oh,
there's
really?
ligaments,
So that's your ACL and MCL?
Yeah, there's all different kinds of ligaments in the knee. And so there's a ligament right here, right? There's all kinds of different ligaments that can get torn.
Got it. And they can generative without...
Well, yeah, if you put PRP, usually there's different ways to do the injection, but you can have the person's leg, their lower leg hanging off the table, and then the patella moves out of the way. You see how it's like right here's patella. So this is a big open area right here. So you just find the squishy area on the person's medial side of their knee, and then you just put the injection and squirt the platelet-rich plasma here, and you can do the same thing on this side. And then all these cruciate ligaments, which are in there, and all the other ligaments, everything in here will then get the yummies, that they need to change the environment to promote healing.
Right.
Now, will it regenerate the meniscus? That's where all the controversy is, right? So stem cells can actually regenerate and create new meniscus, right? And that's this blue piece that you're seeing right here. That's the meniscus, right?
Yeah.
And the other ligaments are all inside right here, and I don't know if you can see them, but there's one, like here's another ligament right here. Those are the ones that can get torn on the inside. And and then there's the ligaments on the sides too. You've got, these ligaments that cause problems. So, the knees are tough, everything. But if you do PRP on each, put an injection on each side, like right on each side of here, and then they have shown in studies that the meniscal repair is more, it happens better with that than it does surgery.
And preparing the environment.
Right. So a lot of times my clients will say, well, I am already on the schedule to have meniscal repair surgery. And they're going to try to sew it or whatever, sew it back together. And I'm like, great. So it's actually been shown that people who have meniscal surgery to try to sew the tear, let's say it's just ripped, because there's like two little discs and they can rip. And so you can try to sew them back together. You will have a much higher success rate of recovering from the knee surgery if you do PRP injections after the surgery.
Oh, really?
Yeah, because now you've sewn it together, but you need the nutrition to like bind it forever, right? And so, I guess the best of all worlds would be to do the surgery and then to do the injection, right? Mm-hmm. To do the PRP injections. And usually you do about 6 of them every week or every other week, and that will promote healing of post-surgery. Wow. But you can also do it without doing the surgery, and for some people, that's enough.
Yeah.
Right? Everyone's different though, so I can't tell you the exact rate. Is it going to work for you? It's so hard, to predict. But there is a lot you can do before the surgery. You could do PRP and then have the surgery and then do it after, and then you will. If you're a snow skier and you live in Vail and that's what your life is, snow skiing, then, if you're an athlete and you really need a full recovery, that is what I would recommend, is doing PRP before surgery, have surgery, and then after, and then do PRP after. And that's like the best of all worlds. You would get the full, and you could do exosome injections. You could do so many different things to try to promote. You could alternate PRP with ozone injections, because ozone would give oxygen to the area and hyperoxygenate. And remember, the knee it has a lack of vasculature. There's hardly any vasculature here. That's like arteries and veins. So it's really hard to get the yummies from your bloodstream into the knee, which is why PRP injections are so awesome. Platelet-rich plasma injections, because they are taking everything that all the yummies that are in your blood, they're concentrating them and then putting them right where you want them, right? Which is hard to do as we get older, especially. There's just not a lot of vasculature here to pull the yummies. Right.
My mom, when she passed at 96, and even just before she died, she would lay in a bed and do her legs like this. And she was trying to exercise. She would move her shoulders around, always trying to do something.
Yeah.
And
if you just lay there, your body will adapt to that new environment, which is no exercise, right? Yeah. So we adapt very quickly to changing environment, and that means our environment here, like not exercising, or I tell people if you like the temperature at 69 degrees precisely in your house, or 68 degrees, and that's exactly the temperature you like it, and if it's a half a degree, at first it's like you could do 2 degrees forward and backward of 68 and you'll be okay, right? But then eventually that comfort zone gets smaller and smaller and smaller, and you can't tolerate even 70 degrees, and you can't even tolerate 67 degrees. Like, that comfort zone gets smaller because you're not doing hormetic responses. You're not putting your body under stress, temperature stress, so you can adapt and be stronger. So your comfort zone gets smaller and smaller and smaller. So it's really important to end your shower on cold, or do hot and cold in the shower, or do a cold plunge every once in a while, or walk outside when you're feeling very healthy, with when it's cold outside. Like, a lot of times my clients I'll see them, and I'll walk outside when we had that cold spell, and I'll walk outside in my short sleeves, and they're like, how can you walk outside in short sleeves? I'm like, yeah. And they're like, don't you think it's cold? I'm like, oh my gosh, it's freezing out here. I'm like, it's very cold. I'm like, why didn't you put a jacket on? I'm like, because I'm walking you to your car and I'm walking back in. I think I can handle it, right? That's my way of trying to subject my body to a small little stress for a very short period of time. I know I'm going to come back in the house and it's going to be warm, right? But the thing is, at least I'm trying to make myself not so sensitive to little tiny changes in my environment. But it's the same way with your body. We have local environments, right? The local knee environment. There's things you can do, DMSO gel, topically, so many things you can do to change the environment to promote healing and, slow down degeneration.
I think that goes along with your entire holistical body. It's your mind.
Yeah.
Because if you do not condition your mind, you're going to get softer, you're going to get more irritable because it's not what you want. You're not.
Yeah, one little tiny thing will tip you over the edge.
I was on TV there on some show, and he was saying, the young boy was saying to his father, he said, I'm not happy, I deserve to be happy, I just want to be happy. And he looked at him, he said, what makes you think you have to be happy?
Right.
What makes you think life is happy?
Mm-hmm. Right.
What makes you think that he said, it's 80% not happy, but live within that to be happy, deal with it, work with it, and make it happen.
Yeah, but there's going to be ups and downs. There's going to be
my buddy Foster was just here this morning with his wife.
We talked to Foster this morning.
So when him and I met when we were 19, we were doing stuff and we didn't, I think we did it without actually talking about it. Mm-hmm. We would put ourselves in these predicaments that we didn't know how we would get out to see if we could do it. Mm-hmm. So there was a big, huge storm going. His brother lived out on some land. We were down in Florida in the swamps, and it was mud and everything. Had 5 acres, and it was pouring rain, 3 o'clock in the morning. We'd been up cooking and working out and all this stuff. He said, let's take the truck out in the field and get it stuck. And he
Great
said,
idea.
He said, let's see how we can get it out. And so here we go. We go out there. We're in our underwear. We get in that truck and we're doing donuts and all this stuff. And it bogged down. Right. We can't see anything. It's pouring rain. I mean, it's kind of cold, but it's raining. We're in our shorts, right? Mm-hmm. We get the jack out. We're horse laughing. We got to crank that thing up. We can't see. So the first thing, you can't see very well. You're uncomfortable because it's raining a little bit. It's 3 o'clock in the morning, you're tired. And I'm like, whoa. So we're jacking this, we're going like that. And he says, hey, look, shine that light over on me. And I shine the light over on him, and he's standing there, and his whole legs were crawling. And he stood inside of an anthill. He jumped up and went wham, and all the ants just fell off of him, right?
Yeah.
And they didn't bite him. Not one bit him. And we horse laughed. I mean, we laughed so hard. But we got underneath there, had to put wood under the tire, and it was muck work. We got the truck out, washed it off, got back in the house. It's probably almost 5 o'clock in the morning. We got in there, had to get up at 6:30, go to work. Mm-hmm. And we had a great time. Mm-hmm. We laughed the entire time. We were soaking wet. We were hungry. We were all this stuff. But that created a resilience in us.
Absolutely.
And I remember
you could figure it out. Like if something happens,
I don't care what happens. I had a flat tire going to Houston a few years ago on my truck, blew up. It was like, all right, how do we fix it? Coming back, blow it out. The other side blew it out. And it was 3 in the morning. I had no money. I was like, and I didn't lose my stuff.
So I'm not against some preparation. Okay, so I'm not entirely.
I didn't have money for new tires, so I didn't.
Completely against being a little prepared. You know, like I like the Boy Scouts motto: always prepared. Right. But I also know that if you go do things in life, shit happens. It just does. Things happen. And you know, I can tell you my own stories of situations I've gotten myself into doing adventures. Like I can tell you. Woo.
But it makes you mentally stronger.
It does make you mentally stronger, and it gives you confidence that if something goes wrong, we can still take our time and get ourselves out of the situation.
Right.
And
this whole approach is what I love about this whole thing.
And you can't, and like young people, I love young people. Like they see, like even when I was in medical school, most of my classmates were a lot younger than me, but we even had our professors who were, my age and older, and we would do polar bearing every January. We do polar bearing, which is, right there was the lake, and it's freezing, and snow's on the ground, and we would all between classes put our bathing suits on under our thing and run down this trail through the forest to the water and jump in.
Gosh.
And it's interesting, but older people would be less inclined to do that compared to a younger person, right? And it's curious to me why, because I think that's that comfort zone getting smaller and smaller.
There you go.
We become like, okay, I can't do that. It's going to be too cold for me. I could get sick. But like a young person, like, yeah, let's jump in this cold water. So, I think in our lives, we have to not be afraid of putting ourselves under a little bit of stress in a cautious way that's not going to be dangerous.
Yeah.
I wouldn't probably put my truck stuck in the mud
I wouldn't do it now either.
Purposefully. But, doing a cold and hot shower and a cold plunge, and even like, You know, if you feel really healthy and strong and you want to do a polar bearing in the ocean when it's cold, knowing that you have a fire and you can get warm right away, I don't think it's a bad thing. I think a little bit of stress on a healthy body will help you stay healthy. And that's Hormesis. I recommend you look it up, what the definition of Hormesis is. And, you know, that's why a sauna is good. A sauna gives you heat stress. And your heart will beat. You'll feel it. And you'll really want to get out of the sauna if you've been in it long enough. All you can think about is getting out of the sauna. That's the perfect spot. That's the sweet spot. You stay in for 5 minutes past the time that all you can think about is getting out. Like, I got to get out. I'm too hot. That's when you set your timer. You stay in for 5 more minutes. That's a stress. That's an induced stress. And all the heat shock proteins and the most beneficial part is going to happen in those last 5 minutes. Okay.
Wow.
So, but it's safe because you know you're going to be able to get out, and you can get out at any time, right? So, like, it's not like you're going to cook in there for 2 more hours. You're giving yourself 5 minutes of being uncomfortable. 5 minutes of being uncomfortable. You can do it. You can do it, and it will help you be more resilient. And our body responds to that with extreme positiveness. I mean, you really become stronger. You know, your physiological responses become stronger. You become less sensitive to things that you would have been sensitive to before.
Yeah.
You know, all kinds of things.
Well,
so, good stuff.
I'm encouraged by all this, and I'm, like I said earlier, the hope is really where it starts, and then you can take them in increments. So.
Yeah, and everyone's different. So, like, what benefits you the most may not benefit that person the most, and so you really got to find and don't be afraid to explore. Like, maybe you respond better with stem cells than I would, or PRP, or prolozone, or ozone injection. I mean, you got to don't be afraid to experiment and find what's going to work for you. And don't give up hope, because there's so many things you can do to get your body healthy again.
Well, what I've liked, and that's why you're on here too, I want to share this with everybody, is that, back 20 years ago, there was nowhere else for me to go. The doctor said, you need new knees. And I knew that they would only last 10 years, they said. And I'm like, good God, I'm gonna have to have 5 surgeries before I die, maybe. So I put it off as long as I could. But now that I know more about meeting you and understanding more and researching all this more, before you do anything, we have a way of researching now. You got a way of looking into other alternatives and really making sure. You grabbed my knee and you moved it in every direction. You said, you know what, your tendons are strong. They're good. It's like, why would you cut all them off or whatever they do on a knee surgery to hurt them?
No, let's work with what you got. And the fact that you're able to walk upstairs and you're able to walk down, yes, it hurts and it gets your attention. And yes, doing a 3-mile hike down into the Grand Canyon is probably not something you would be happy about because your knees hurt going down. You can still walk right now and you can still climb up and down stairs. That's enough to work with. To me, if you can do that, we should wait on surgery. We should work with you, even if it takes 2 years. You're going to be 2 years older 2 years from now anyway. If you, God willing, and you stay alive and don't get hit by a bus, you will be alive at 67, right? Okay?
Yeah.
And so, like, why not work very slowly, little at a time, and see if we can slowly, incrementally get it better. And then 2 years from now, it's actually way better, but it's going to creep up on you. Sometimes it's very slow. Like, my mother had osteoporosis in her big toe joint. And that's common with older people because it's a repetitive use injury. You use your big toe to stabilize. And so it got so bad and the joint grew, a lot of extra calcifications in that joint where she could barely walk. She's like, this was like 7 years ago. She's like, I'm not going to be able to walk at this rate. If it keeps getting worse, I'm not going to be able to walk. I'm limping around already. I'm having to buy special shoes and it's still not enough. Now, 7 years later, she's dancing. She dances.
Wow.
Right? It's gone, the pain. She feels it if she uses it a lot. So if she goes on a long hike, she'll feel, and she's 75. I mean, she's like, she's not a young pup, and she's dancing and hiking, and she looks amazing.
Wow.
She admits to me the pain in her toes, both of them, but one was real bad. The toe has straightened out now. Right? It was deforming and there's no pain. So she doesn't have to buy special shoes. She doesn't think about the pain. Before, it was every step she took, she was in pain from the toe. Not anymore. It's gone. I'm like, well, Mom, look, 7 years happened and now you're better. Look at that. And we're just going to keep it getting better. I've got her on because her fingers were starting to deform from osteoarthritis. They're straightened out now. Not completely, but they're way better than they were 7 years ago. So, like, there are things you can do but it will take time. You've been doing this knee stuff, and sometimes you feel like, I keep doing this and I keep doing it, and it's like 4 months of consistency,
Yeah.
and maybe I feel a little better sometimes, and sometimes I have a bad day and it's worse, but it's only, you're not up to year 7 yet, right? Like
Yeah.
give it 2 years and I bet you'll feel, give it 5 years and you might be able to actually snowboard and hike down into the Grand Canyon. And I'll take you on Havasupai Falls hike, one of my best, and that's a downhill hike.
I'm wanting to go.
Like
wanna
it's
go.
you got to have some
Stairway,
you got to have
yeah.
some knees and ankles for that one, because
Yeah.
uphill
Wow.
it didn't bother me on
Right.
that hike, but downhill
I could climb Mount Everest.
I don't even
Yeah.
have knee and ankle problems, and they hurt. Like I'm even almost crying when I get to the bottom, because it's like 10 to 12 miles downhill. And that'll. But
Nope.
man, that would be the winner. If you could do that in 5 years, then this worked.
All right, let's set a date. That's
Why
where I'm
not?
heading.
Let's do it. Yeah.
Yeah.
Okay.
Thank you, Deb.
Yep. No problem.
We're going to bring Deb back more, and I really, this is a passion of mine, and I hope it's something that'll help you guys in our quest of being healthy, and as we grow older, and as even young people, you guys, if I would have done this in my 30s, I would have done so much more preventative stuff. I know my son, he's 31. He's already looking at the preventative stuff that he's trying to do in his life, and that when he wants to snowboard forever. And he's starting to look into all this dieting and all this
Got to do a
preventative.
little tender loving care.
You got
then.
it. So,
Yeah.
all right. Deb, you've got a website. Or
Yep.
a website.
You just have to Google Emergent Health. So like that's my just Google Emergent Health, and I'm the first thing that comes up. It's a little dragonfly, and that's me.
Emergent Health. And then we hope to get maybe some YouTube going
Yeah.
up more. And
I'm gonna try to put some more stuff out there this year. So
All right. Thanks, guys. Hope you enjoyed this podcast. I got to turn it off.
turn it off.
All right.